PFAS are chemicals that are not good for you, and yet they are in plenty of everyday products.
The CDC has a new recommendation for physicians. Taylor Tashev joins us now live in studio with more on this. Taylor.
Valerie and Alicia, the CDC is now encouraging doctors to talk to patients about PFAS exposure and consider blood testing, but that test might not be for everyone. PFAS are known as forever chemicals.
It really comes from the fact that they just don't degrade. They're very stable.
And found in a myriad of things like water-resistant fabric, personal care products, food packaging, nonstick cookware, and drinking water.
Only in the last few years, really, have people started to investigate these. And the more they investigate them, the more we seem to find them.
The CDC is recommending healthcare providers talk to patients about blood testing for PFAS.
It comes down as a little bit surprising. If you test somebody, it is very likely that somebody's going to test positive for a PFAS chemical. Now, what those things come back as and what those actually mean in terms of whether or not it's going to cause a bad outcome in you is really questionable.
The CDC says potential health effects associated with PFAS exposure include higher cholesterol, lower birth weight, kidney and testicular cancer, and elevated liver enzymes. But doctors say pinning that on just PFAS is difficult.
All of these are factors that have many things that can contribute to them. So I don't think that a single blood test without a conversation with your doctor is the way to go.
But there may be some people at higher risk, most of the time caused by occupational exposure.
Our workers who work in chemical plants who use these substances, fire retardants and fire extinguishers are well known to have these substances in them and have significant amount of exposures.
The recommendation is stirring up questions. The blood test can detect PFAS levels, but there are currently no approved medical treatments available to reduce PFAS in the body.
Being educated on what is actually likely to have those kind of chemicals and likely to have those things is going to be the one thing that I'm going to tell you that has to happen.
And it's important to point out, this type of blood test may not be widely available. The test could be expensive or not covered by insurance. Live in studio, Taylor Tashev. Valerie, back to you.
Good information there, Taylor. Thank you.